Welcome to Lupus LA's Your Story, Our Fight podcast, brought to you by our good friends at GSK. Today is our 20th episode. Can you believe that? We've done 20 episodes, and we have a very special guest who has been with Lupus LA for probably almost 20 years. Vania Dzib is a lupus advocate, a teacher, and has been part of the Lupus LA Children's Hospital support group when she was first diagnosed and when we first started the support group. So I'm really interested to talk to you, Vania, today about your experience having jumped into a support group so early in your diagnosis and all the way up through your transitioning into out of pediatric care into adult care and all the things you do. So welcome to the podcast.
Thank you guys so much for having me. It's such a joy and a pleasure to be asked to be here today.
Of course. So you're probably, not only do you have the distinction of being our 20th guest, but you are probably the guest who was diagnosed the earliest because you were 10 years old, right?
Yes, that is correct. I was diagnosed just after my 10th birthday.
So how did it happen? How early did you notice that you had symptoms?
My mom remembers it as almost maybe a week after my 10th birthday. My birthday is in September. By December, the lupus had fully aggravated my entire body. So it was pretty fast, pretty aggressive, and yeah.
And so prior to that, did you have any anything wrong? Were you a normal kid till you were 10 years old?
Yeah, you can pretty much say I was a quote-unquote normal kid. I was very active growing up. I loved swimming lessons, so I was out in the sun all the time without the sunscreen, and I was running about, eating, could keep up with other kids. Yeah, there was no other telltale signs at all. It was literally up to that point, after the 10th birthday, that things just went downhill.
And how quickly did that, I mean, that really was was there a triggering event? Did you I know some people's, their lupus kind of flares after an accident or another medical condition.
For me, it wasn't an accident or anything medical. What made us really pay attention was at the time I was really into the sport tetherball.
Oh,
That
yeah.
was my sport
Love
in
tetherball.
recess.
Absolutely.
Yeah.
I learned that in camp. We did a lot of tetherball in camp.
That was my sport. And as you know, you have to use your hands a lot for that. That's where the arthritis mostly hit me in my hands at that point, in my hands. So when I would go to play, I couldn't keep up with my present. That was my big present that my parents invested in, my own tetherball at home. So I went from playing it for hours at recess and lunch and playing after school and coming home and playing with it to not even touching it anymore. And my mom was like, something is wrong.
Right.
And I would complain, my hands hurt. My hands hurt. And she's like, you only hit it like once or twice. Like, it's not that hard. Like, I wonder what's going on. So she thought maybe it's too much tetherball. So I quit the tetherball, but the hands continued to hurt.
And then, so the hands was your first major symptom, and then it ballooned. It went pretty quickly then to your organs, your other parts of your body. How did that transpire?
Yes. So next, I developed a lot of fatigue. I went from the energetic, like I said, I was into sports. I was very into swimming. I quit that. I went from all I could handle at the time was school. Then I would come home and knock out. I couldn't play with my little sister anymore. I lost interest into Barbies, cartoons, into everything. I wasn't a child anymore, loving life. I went to school. I barely stayed up to do the homework, and I would knock out and go to bed. And that was it. That's all I had the energy for. And the eating, I would barely eat. My appetite went down to minimum. The things I loved to eat before, I didn't care for because I just didn't have the energy anymore.
So when did you then seek medical treatment? Was it sort of started with the pediatrician and then accelerated?
Yes. So from there, I started developing fevers, rashes, and whatnot. So my mom thought it was a cold or something going on around the house or something. We saw pediatricians in and out of around our neighborhood. We got the whole runaround of she's lazy, she's just a kid who doesn't want to go to school, she's faking it. It's just, oh, it's just a cold. Oh, it's just something that she's fighting, but it never went away. The fevers, no matter how much antibiotics they gave us, it never went down. And I lost so much weight that the pediatricians were just seeing us after hours even, and they were just like, we don't know what's wrong with her. We're up to our legal status of what we're allowed to give her now. So they ended up transferring us to the point where a doctor who only sees elderly people saw me. And he saw us kind of like what you would say, like underground. Like he saw us like not legally, like what you would say on the books. He heard how bad it was, and so he was like, let me just see this child. This is really bad. So my mom was so desperate. She was like, I'll see anybody. So he took a look at my hands and my bones and stuff, and he heard the symptoms my mom was describing, and he knew what it was. So he did a referral to Children's Hospital. He told my mom, don't go home. She won't make it. Go to Children's Hospital tonight. Don't even pack a bag. Go home. Go to Children's Hospital. So my mom made a call to my father, said, we're going to a hospital. She thought, we're going to go to the hospital and we're going to get medicine, and we'll be home. It'll be a good. They admitted me right away, and from there, the doctors saw how bad I was. They were the only ones that really saw there at Children's Hospital how bad. My mom remembers how frustrated they were with, like, I can't believe these pediatricians didn't see how sick this child is. I'm saying this pretty fast, but this was 2 months of us in and out of
Which is
pediatricians'
still,
offices. It wasn't.
interestingly, I mean, there are so many stories that we've heard that take years to get diagnosed. I mean, I think what's interesting about your case, and I know this to be
Yes.
true for pediatrics, is kids deteriorate more quickly. Kids with lupus have more serious lupus, and
Yes.
therefore, fortunately,
Yeah.
you got to the right place. So you're 10 years old. You're
Yes.
admitted to Children's Hospital. Tell me about not the physical side, but what's your mindset? Like, what's going through your head?
Um, and it's a little hard to answer that question, but it's a lot of almost I'm clueless because in my mind I'm so like innocent in all this. I don't know what's really going on. To me, I'm just kind of like sick with another like bad like tummy ache or something going on. Mom's gonna give me
Hmm.
medicine and I'm gonna
Hmm.
feel better. And that's it. I just miss my friends at school and I want to play with my tether ball. Oh
Right.
my gosh. And I don't
Right.
have, and I can't, you know? So, in our minds, we had no idea what we were entering into. We had never entered a children's hospital. We had never had
Hmm.
something this huge happen in our lives. So,
And how long were you admitted at that first time?
um, it's funny. We never left that hospital after 2 months because the lupus had gotten that severe after that. I they admitted me right away because they did all these tests on me and stuff, and they saw my kidneys were really bad. I had developed already a rash on my skin, so they knew the lupus was already very active and already attacking the organs. So they told my mom, listen, she's not leaving. Your doctor was right. She won't make it if she's not admitted right away. So they started doing all these kind of medicines that we all know that is very common for us, steroids and getting fluids into me because I was very dehydrated, had little to no calcium in me, and I was very physically deteriorated with my joints not having moved a lot. So once I was admitted, they gave us about a week there. We stayed, and in that week, they saw that my body improved a lot. Not to the point where I was all better, but enough where the doctors felt like they could send me home and send my mom home with a list of the medicine and what our life was going to look like now with Vania with lupus. And it was going to be very different, obviously. But the night we were getting set with the doctors and writing up all the stuff that we were going to do, the treatments, the medicine, the therapies and whatnot, I had a horrendous seizure. That seizure left me in a coma. That coma completely erased my memory. To this day, at 27 years old, I can't remember my childhood. I don't remember meeting my sister when she was born. I don't remember learning how to ride a bike. I don't remember going to first grade. Like
Wow.
lupus took a lot more than just my health. It took my childhood
Mm-hmm.
away.
Mm-hmm.
Something that people take for granted. I don't have that. So,
Oy. That's a scary, scary story. And I'll tell you what, you know, I'm not so sure I've heard that full story. And I met you probably around the time you were 11, 12 years
mhm.
old, right? You
Yeah,
were
it
one of
had
our
almost
first,
just happened.
yeah. You were one of our very first patients at the Children's Hospital, the CHLA support groups. Um, and I met you probably within that first year. And I remember you specifically because you really were wise beyond your years, scared and lots of steroids and lots of, um, but I specifically remember meeting you. You were very smart, very precocious. You seemed to really kind of have a maturity about how you were approaching the disease. And I wonder if where does that come from?
Um, I feel like that came a lot with my mom and also with the doctor that I had, Dr. Rice.
Good old Dr. Rice.
He he um he for sure didn't baby me when I had this disease. He did I mean tend to me like I know it hurts that you have this. I know it's not easy, but he's like I know you can do it. You were given this and I know you can live through it. And he was even the one that pushed me even to reaching out with you guys. He was like, I can already tell you are going to be my patient who's going to shine. You can speak. Your story, he said, you can use this. He's like, I've never had a patient like you. And I was just like, what are you talking about? You are nuts. Like, I'm just trying to get through this and trying to like hide my moon face with all this prednisone, and you're over here saying stand in front of people and speak? What?
Well, he and I
Like,
were on the same
no.
page, and I'll tell the audience here. You spoke at, I don't remember exactly what year it was, but one of our Orange Ball events. We did a video with you, and you spoke to our audience. And we've been doing this a long time. I've done a lot of events, but that crowd at that event was really so powerfully moved by you, and um, we raised a lot of money that night, and we've done a lot of good together since then. And I want to get into, I think what's really important for our audience to hear is how you transitioned from the pediatric world into that adult world. And I know that's a big topic for you. Let's take a break. We're going to come back after the break, and we'll talk about kind of that transition from kid Vanya to adult Vanya, and we'll let the audience know how that goes. We'll be right back.
Lupus LA offers virtual support groups on a weekly basis and a bilingual and family support groups once every month. For more information, visit lupusla.org.
Welcome back to the Your Story, Our Fight podcast from Lupus LA. I'm Adam Selkowitz, your host, and we're talking to Vania Dzib. Vania, we were talking before the break about you really did a lot of work with our pediatric support group. First, before we go to get into how you transitioned to the adult world, what did that pediatric support group do for you over the years? Because I know you participated in it for a long time, and that support group is really unique. And there's really 3 support groups: one for the family member, one for the parents, one for the patient, and one for the siblings. And they all come together on the same day, and everybody kind of learns from each other. And so it's a really wonderful, unique program that we do. But tell me, what did it mean to you during your struggle with lupus?
Oh, I think it meant everything. And I would dedicate a lot of my strength to those support groups, definitely. I'm not going to lie, at first I dreaded going to them because I was one of those, and my mom was like, come on, you're going to go. I didn't want to sit there and talk about my feelings and stuff. But no, I ended up loving it and even returning as an adult. But it meant everything to me as a patient, building a community with kids who are going through the exact same thing that I am going through meant everything. I would hear Dr. Rife tell me, there are kids like you going through the same thing. And it's so different hearing that, yeah, there is a kid out there somewhere going through it, but I don't know them. I haven't met them. I don't get to talk to them. You legally can't tell me who they are, where they live. I don't get to Facebook them or text them or nothing. So in my world, they don't exist. So I feel alone still. That doesn't help me. So to have a safe place like the hospital to go to, and for a lot of us, the hospital isn't a fun place. It doesn't bring us a lot of fun memories. We go there and get shots and bad news, and we don't have the fondest memories. So to go there, see friends, laugh about the dumb things we go through, this medicine, yeah, I hate it too. Don't you get this and that side effect? And oh yeah, that doctor's cute too, huh? And all this dumb stuff that we would laugh about that only we get and only we understand. I mean, I'm 27 and I still have those friends on my phone to this day. I mean, it's a bond that, I mean, you can't pay enough for that. Like it's something I treasure forever. It's definitely given me the strength that I still have.
I love hearing that. And then I think that one of the challenges in transitioning out of the pediatric world is you do have all those bonds, and you've created these relationships both with the doctors and with the other patients around you. So what was that like? Walk me through kind of how you left CHLA and where, how that worked.
Yeah. So the transition, it wasn't easy. I mean, I basically grew up there. I was 10 and I left when I was 21. So I had a long history. Even the people at the front desk and the valet people knew my mom and I by face. Like it was that close knit. We were there way too much. So it was hard. But I think also what helped was there was a transition whole clinic, so they definitely helped us. I think what also helped, and that's Dr. Rife helped when he was pushing me to be very more self-sufficient, more he would make my mom not answer any more questions. He would only talk to me and he would make me answer all the questions. So I'm not going to ask mom how you were feeling or what the list of medicines are. It's Vania because at some point mommy's not going to be there for you. So I mean, now I go to the appointments by myself and whatnot, so it wasn't that big of a deal. I mean, at first it was really hard, but now, I mean, it makes a world of difference.
Mm-hmm. So I think that's a good point.
So,
It's like you really need to train. If you're a parent out there with a child with lupus, you really need to help educate your child as they go through the process. So it's not all turning it
yes.
over on one day. Here are the keys to the car,
Oh,
that
yes,
kind of thing.
exactly. It's a lot, and it's a lot for the child too. I mean, we all know. And it was hard for my mom too. And she won't deny that. I mean, it was hard to let go. She would always come with her booklet and whatnot. And she wanted to answer for all the stuff. But Dr. Rife said, like, she needs to know this is part of her life. Like, she needs to know what if there's an emergency? She has to be able to speak up for herself.
Mm-hmm.
And also, that's just so empowering for us too. We need to be able to say,
Yep. No, I think that's a really important point. It's not just the burden and the workload, but it's a tool to become more in control of your own illness. When you make that transition, really having that ownership of it does make you feel more functional and more and healthier, I think. So tell me about, I know there were a lot of struggles for you in sort of that career, school. How did lupus play a part in your path, in early adulthood? And how did it lead you to where you are now?
Yeah, so in adulthood, it definitely, I would say, held me back a little bit than the regular adult, I would say, quote unquote. I have friends that got even their driver's license like at 16, 17, and I wasn't there yet because my head was more preoccupied with health stuff and whatnot. So I got mine a little bit later, like in like 18 or 19, so a young adult. So even stuff like that. So in college, I definitely advise that if any parents or even someone, a patient with lupus, if your college has a disabilities office, use it. At first, I didn't want to use it. I thought like it's kind of negative, like I'm not disabled, really, like physically, like I can move, I can walk and whatnot. But I mean, the days that even like I felt really fatigued or whatnot. I mean, it helps. You get extra time on test. You get printed notes with the workload and whatnot. I mean, it was amazing. Like I would get my fellow students next to me being so jealous. Like, oh my gosh, I want that. Like, sign me up. Where's the lupus card when you need it? Like I was just like using it like candy because I was like, yep, I have it. I want my extra time.
Well,
for
I
the
mean, it
test.
probably, if you can eliminate some of that stress, there really probably is a medical benefit to being, under less pressure.
Absolutely. And some of those classes, I mean, to get from one building inside of the campus to another in like 15 minutes and you're expected to be there. I mean, it's crazy.
So you're a teacher now.
And
How did that come about? And did lupus play a part in sort of that career choice?
I would definitely say it did. Um, I knew since I was little, I wanted to be helping in some way. I always liked helping, even in when I was little. I liked to be the teacher's pet. Um, so, I mean, when I got into high school, they had a program where we could go and get credit for child development and go to the next door preschool and help. And I just fell in love with the kids there. So I was like, I want to do this for the rest of my life. I just felt like I had sensibility with kids and I just felt a connection with them. Like almost like because I almost felt like I left out on
Yeah,
that
I was
kind
going to
of
say
part
that.
of my life. I was just that I just felt like just this joy in it. Like it's almost like what I left out on, but I just feel the sense of joy just in what they do. And just this for them, even just sitting down and playing with the strangers, hitting blocks and whatever, and watching it fall over is just like the love and joy. They're just carefree. They're not thinking about money and this problem of this and that in the world. Like it's just it's love and joy in their eyes, and that's it. And I just love that. I get to sit in a room with that and get paid for it, and I love that. This is just pure joy.
I love that you
So.
found that. Because I there's a lot of, I remember even though you were super sick when we met, you had that light in you, that joy. And I think it's terrific that you're bringing that to kids. And, so tell me, I always ask this question, and I won't let you not answer it, but what's that advice you give to a 10-year-old or a 15-year-old who gets diagnosed today? Because I think, I have a lot of adults on this show who are getting diagnosed in their 20s, but there are these kids who are getting diagnosed really, really young. And what's your advice, not just to the patient, but to the parents?
I would definitely say um, to find support, a community. I think that that's everything. Without the support that I got, even just at home, and I've heard stories where they aren't supported at home. So sometimes that support isn't at home, unfortunately. But if you can find that support via a Zoom support group, or you can find it through a friend or through a loved one, or just through someone who is kind and willing to listen, I would say get it because no one should have to go through this alone. Speak out about it. A lot of times people feel like we need to keep it inside. No one should have to burden about hearing about it. But most of the time when I tell people, they never backlash about hearing about it. Most people are very sincere and very heartwarming about it.
Yeah, no, I think that's all really, really good advice. And I think find the joy. To me, I think that's a message that I take from you all the time. And I think it's really inspirational. You've gone on, your love of support groups carries on, because I know you helped start our young adult support group, our virtual young adult support group. So I'm really thrilled. You're our poster child for the support group program. And thank you so much for sharing your story, and wish you the best of health.
Thank you so much, Adam. Thank you for all you do and for just keep spreading the word of awareness, and just love to you and your family and all your hard workers out there.
Thanks, Vanya. On behalf of the entire team at Lupus LA, we thank you for joining the Your Story, Our Fight podcast. Please tune in, spread the word, and come back for more inspiring lupus stories. I'm your host, Adam Selkowitz, wishing you good health, and to always remember, your story is our fight.